interrupt Super Bowl 25 to bring you breaking news about a new type of therapy that medical doctors are prescribing to their patients to recover from many types of conditions. More on aquatic therapy is Justin. Justin?
Hi guys, I'm Justin Time here, and in 1911, Dr. Charles Lohman, who is the grandfather of aquatic therapy, brought the idea of using water to help treat patients from Chicago, where they're using the water to treat patients with paralysis. He wanted to use it and try it with patients who suffered from spastic cerebral palsy, so it had some effects, as you'll find out down the line. And in 1924, Leroy Hubbard created the Hubbard tank, which is named after him, and one of his most famous patients, one of the most influential people in the world, was FDR, who suffered from polio. In the 1930s, journals started to publish more research articles about aquatic therapy and the effects of it, so we started to gain some more recognition as we went. And in 1937, Dr. Lohman comes back into the picture, and he started to define the parameters for effective underwater exercises and therapy. And in the 1950s, the National Foundation for Infantile Paralysis started to show support for polio and the use of aquatic therapy in treating polio. In 1962, Dr. Sidney Licht organized the American Society of Medical Hydrology and Climatology. Back to you, Rich.
Once again, I'm rich, but not that rich. The training required to become an aquatic therapist involves getting a degree in either physical therapy, occupational therapy, or athletic training. Once you have one of those terminal degrees, you then go and get a certification of an aquatic therapist specialist. Currently, the only body that offers this specialty is the Aquatic Therapy and Rehab Institute, or the ATRI, and they offer classes to both healthcare professionals and layperson alike. If you are a layperson, however, and you take the certification class, that does not make you an aquatic therapist, but just gives you more knowledge on the subject. You still require one of the terminal degrees. Patient populations that may benefit from this type of therapy, according to medical doctors, is patients that have underwent a spinal cord injury, those that have muscular dystrophy, those that have respiratory issues, patients with musculoskeletal conditions such as fibromyalgia, osteoarthritis, or a post-op patient that may not have full weight-bearing status, patients that are athletes and that underwent an injury on the field, older patients that may not suffer from osteoporosis, patients that are pregnant, and patients that are obese. More on aquatic therapy is Sue Wimmings. Sue?
Thanks, Rich. I'm Sue Wimmings. Next, we'll discuss the biological effects of aquatic therapy. First to consider is that the body is less dense than water. Also, when a body enters the water, it displaces the amount of volume of water in equal force, causing an upward motion on the body. This allows the body to float. Floating can be therapeutic for decreasing weight bearing in conditions that require decreased joint compression to allow better healing and function. Next is hydrostatic pressure, which is pressure exerted on the body by water, causing increased pressure internally. This can have effects on fluids within the body and can include blood pressure, respiratory efforts, and edema reduction. How water moves, termed viscosity, also has effects on the body. As water moves, it creates drag force and turbulence. This can increase resistance as the body moves through the water, and as velocity increases, so does resistance. This can enhance control of strengthening activities with patients. The temperature of water can also have different effects on the body. Temperatures between 10 and 15 degrees Celsius can be useful for decreasing muscle speed and pain, and for overuse injury recovery. Warmer temperatures between 33 and 55 degrees Celsius can have many therapeutic effects on the body. For one, it has calming and relaxation effects on both the brain and the muscles. Continual tactile stimulation provided by the water is also helpful for those with sensory processing issues. Also, warmer temperatures can help reduce muscle spasticity and prepare the muscles to do work for further interventions. Considering all these effects on water, there are many pros and cons to aquatic therapy. Pros include providing a warm and relaxing environment conducive for decreasing impact on joints, providing a place for weight loss, aerobic activity, unweighting the limbs, helping venous circulation, and constant tactile stimulation on the body for calming and relaxing techniques for those with sensory processing issues, and providing resistance training. Cons, though few, may include having difficulties even getting a patient into the water due to self-image issues. Also, skin irritation or allergic reactions can happen in relation to the chemicals in the water, and there is also potential for drowning or near drowning incidents. Also, there is a little bit of difficulty with carrying over activities from water into land-based activities. Recent research in the fields of aquatic therapy has taken a closer look at effects on cerebral palsy, developmental coordination disorder, Prader-Willi syndrome, and juvenile idiopathic arthritis, just to name a few. These studies have found increases in range of motion, strength, muscular and respiratory endurance, and increased locomotor performance, including increases in gait velocity, decreased metabolic cost of walking, and a reduction in pain. Also, these studies have found an increase in scores on the MABC, the GMFM, and the pictorial scale of perceived competence and social acceptance. Now, back to Rich and Justin in the studio.
Thank you, Sue. And well, it's a sad day in Buffalo now, guys. We'll show you the rest. Thank you. Just in time.
Rich.